Discarded syringes, used test kits, and old vaccine bottles from the COVID-19 pandemic have created tens of thousands of tons of medical waste, a World Health Organization report said on Tuesday. It says the material is a threat to both human health and the environment, potentially exposing health workers to burns, needle stick injuries, and disease-causing germs.
Of the total amount of waste generated in the healthcare setting, about 85% is deemed non-hazardous, and the remaining 15% is considered hazardous material. Non-hazardous waste is waste that does not pose any biological, chemical, or radioactive hazard. However, the buildup of non-hazardous waste, such as plastics, can still have a negative impact on the environment. There are 7 main types of hazardous waste that are released from healthcare settings. Infectious waste, pathological waste, sharps waste, chemical waste, pharmaceutical waste, cytotoxic waste, and radioactive waste.
While this hazardous waste only makes up a small percentage of the total waste released from healthcare facilities, hazardous waste can have dire impacts on the environment and the health of organisms that come into contact with it. A major concern is how medical waste is being mishandled and disposed of incorrectly, which attributes to this waste ending up in areas that are extremely harmful for living organisms and the environment as a whole. Chemicals from medical waste can contaminate water bodies and groundwater, which directly affects water supply and wildlife. Medical waste also impacts the soil. Toxic medical waste chemicals can leach into the soil, which leads to contamination of soil, which can have a detrimental effect on ecosystems as well as agriculture. Medical waste also has direct results that are impacting climate change due to the greenhouse gas emissions from current medical waste treatment methods and the energy consumption of these processes. The most evident effect of medical waste in the environment, however, is the physical buildup of waste from healthcare facilities, seen in landfills and the ocean. An example of this is that over 8 million tons of COVID-19 pandemic-related plastic waste had been generated globally, with more than 25,000 tons discharged into the sea, impacting the marine ecosystems. As current employees of mHealth Fairview, we feel as though this is an area that we come into direct contact with in our daily lives. Medical waste is something that we see often overlooked in the healthcare system, and we, as future healthcare professionals, would like to see that changed. Sophie and I currently work as nursing assistants at the University of Minnesota's hospitals. Part of our daily duties are stripping rooms, which is cleaning your room after a patient has left the hospital. Part of this task includes throwing away anything that was in the patient's room, and I mean anything. The only things that are spared are things that are able to be completely disinfected and reused, such as toys and certain medical equipment. The bulk of stuff we are responsible for removing is thrown away, even things that are unused.
When we walk into a patient's room, we put on a mask and gloves and throw them away once we leave. And we repeat this process without a second thought, going through countless masks and pairs of gloves every shift, and that is just for one employee. When we first started this job, we were shocked at the amount of unused stuff that gets thrown away and ends up who knows where.
It could be super easy for us to simply continue going about our job as we have been, without thinking about the waste that we are single-handedly contributing. But after starting this project, a lot has certainly been put into perspective. It is extremely unsettling to us that the place that we work is responsible for generating an amount of waste that is of such a large magnitude. Countering this problem is a slippery slope, though, when the whole goal of a hospital is preventing the spread of infection, the sole purpose for why we discard all of the things that we come into contact with.
As we both are planning on entering this work field for a career, we want to understand all aspects of the healthcare field, as we feel like the waste within the system is often overlooked. With the constant use of protective equipment, we wonder if it is possible to integrate more equipment that is able to be reused with proper handling. We don't think the answer is simple, but we want to hope that others who feel the same way as us will continue to search for better ways of handling medical waste. When thinking about solutions to medical waste, we need to understand that it is impossible to eradicate many causes of waste due to the vital role it plays in safety for the patients and care providers. With that said, the correct disposal of medical waste is crucial to limiting the final effect on the environment. Medical waste is currently being disposed of through a process called incineration or burning because it is deemed the safest solution to the buildup of medical waste. It prevents the waste from building up in the environment in landfills, but can be harmful to the environment as it pollutes the air through the release of toxins and smoke. A possible solution to this would be a more eco-friendly incineration that is possible. It has just not been implemented in any healthcare systems. Medical waste management practices, assessing the environment, raising awareness of this issue, and the training of healthcare workers are all practical forms to consider when creating a more sustainable solution to medical waste in the environment. Collaboration among health professionals will also be important in order to brainstorm ways that incorporate safety for patients and workers, along with minimizing the waste produced. A simple beginning solution could be start with educating medical workers on the correct handling of medical waste, as incorrectly handling medical waste can lead to potential hazards, injuries, and exacerbation of pollution in the environment. In London, the Great Ormond Street Hospital saved about $120,000 in expenses by eliminating 21 tons of plastic waste through proper training for employees on the use of disposable plastic gloves. Reducing amounts of medical waste is not only beneficial for the environment, but also the economy. This proves hospitals can implement ways of proper sorting and classifying medical waste with education that can lead to significant reductions to the overall effects. In addition, more research and innovation are going to be necessary to identify other sustainable ways of disposing medical waste while limiting negative effects on the environment and human health while integrating these practices into hospitals around the world.
Although all medical equipment used in healthcare is necessary for the safety of the patients and providers, there has been a recurring pattern of increased medical waste, partly due to the COVID-19 pandemic that has been finding its ways into oceans, as seen in this video. Medical waste is also posing harm due to its buildup in landfills, presence in the soil, and its toxins in our air. We cannot rid the planet of medical equipment, but as future healthcare providers, we can help cultivate and facilitate new ways of handling and properly disposing of this medical waste.